Hello, and welcome back to the American Heart Association's Red Chair series, sponsored by Rochester Regional Health. While there are several cardiovascular disease risk factors we can manage, some we can't control. Today we're going to talk about one of those, our genetics. I'm joined by Dr. Amanda Coniglio, who specializes in advanced heart failure with Rochester Regional Health. Dr. Coniglio, can you tell me about genetic testing?
Yes, so genetic testing is looking at our genes, which are the parts of our DNA that encode for protein. We know that proteins are responsible for most of our bodily functions, how our heart works, how our vascular system works, and so most of our diseases are tied to issues with those specific proteins and the genes that code for them. So when we do genetic testing, we often do a cheek swab or sometimes blood work if needed, and we are looking for specific genes as they relate to the cardiovascular system to see if there are any abnormalities in that can cause disease.
We know science is advancing all the time, but what are some of the limits of genetic testing at this point?
Yes, so about 25 years ago now, we did the Human Genome Project, which took months on end and cost millions and millions of dollars. While 25 years seems like a long time, in science, really not too much. And so we've come a very, very long way since that time. We can now do genetic testing in a couple of weeks and get results, but that has only been a more recent advancement. So we are still learning a lot every single day about everyone's genetics, and we're trying to test a more diverse population to get more information about patients from different populations and how their genetics play into disease.
So who should actually get this testing?
Anybody that has a personal or family history of cardiovascular diseases. Specifically, we're looking at heart failure, which includes hypertrophic cardiomyopathy and amyloidosis, arrhythmia, so any abnormal heart rhythms or sudden cardiac death in a family, high cholesterol syndromes, as well as aortic syndromes such as aneurysms or dissections. Those are really the main cardiovascular diseases that we know have a strong genetic predominance.
I think it's interesting you mentioned a lot of conditions there, but not heart attack, which is probably one of the most well-known. Can genetic testing help you pinpoint your risk for heart attack?
Yes, so we see lots of patients who have a very strong family history of heart disease or heart attacks and want to know their individual risk. Heart attacks are very multifactorial, so we know that things like high cholesterol, high blood pressure, stress, obesity, poor diet, smoking, all of those things contribute to our risk of heart attacks. Heart attacks have not been linked to one or two specific genes like some of the other syndromes that we talked about. So there's no one genetic test that we can do to understand a person's risk of heart attacks, but we encourage all of our patients to talk with their cardiologist or their primary care doctors about how to control their risk factors to lower their risk of heart attack.
So obviously there are some limitations. Can you share some of the pros and cons of genetic testing?
Yes, absolutely. The huge benefit of genetic testing is to know what you're at risk for earlier on. If you inherit a genetic mutation, that does not 100% mean that you're going to get the disease, but we want to keep an eye out for that with screening. If we find any evidence of disease early on, it's best to treat it early before the symptoms become more significant. So the huge benefit of genetic testing is to find disease or risk for disease very early. There's very few complications or downfalls to genetic testing. Genetic testing results are not available for insurance companies, so it can't impact your health insurance, but it can impact life or disability insurance. So especially for our young patients who are otherwise healthy, we always encourage patients to look into life insurance or disability insurance if that's something that they're interested in before embarking on genetic testing.
That's great information. Thank you so much, and thank you all for watching the Red Chair series.